Hi everyone, I'm Jennifer Blevin-Smith with Integral Clinic Solutions, and you're watching my YouTube channel, Navigating the Business of Medicine. Today we're going to talk about MCOs. MCOs, or Managed Care Organizations, are basically a health plan. It's where an insurance company or an entity comes in and they partner with providers, healthcare entities such as hospitals, specialists, other types of care, and they want to manage the costs of these providers giving care to their beneficiaries at the same time as making sure that high quality care is being given to their beneficiaries. You are probably very familiar with managed care organizations because there are different types of MCOs out there within each insurance plan. So you can have PPOs, HMOs, EPOs, POSs, you can have Medicaid MCOs, and you are probably also familiar with the Medicare MCOs, which are the Part C plans or Medicare Advantage plans. Not everyone refers to all of these as MCOs, but they might say, oh, it's their managed care plan or it's their managed care organization or something like that. But that's exactly what these are. It's just being very, very definitive and very specific when you're talking about this kind of thing. Medicaid in about 41 states, including Washington, D.C., actually utilize MCOs or managed care organizations to implement the actual state's Medicaid coverage and plans within a state. So, like in Oregon, our just basic Medicaid plan is called DMAP. Everybody has just a basic generic term. It used to be called Oregon Health Plan back in the day as well. But now we utilize multiple different managed care organizations to facilitate members' coverage if they're on Medicaid. And in the state of Oregon, it depends on the county in which the patient lives. So you would only be able to contract and credential as a provider or health care facility or group with the managed care organizations in which are close to your location, based off of your county, where you're located in the county, if you're close to county lines, etc. Sometimes you can contract outside of the county. That might even be not even a next county over MCO's plan, depending on your specialty, maybe how rare your specialty is. Maybe there's no specialists within a certain radius or MCO plans for patients who live in different counties, so they would have to drive to your county to see you because of your specialty and the rarity of it. And that's just one of those things that you have to deal with as it comes up. But 41 states, including Washington, D.C., actually utilize MCOs to distribute and facilitate their Medicaid plans. The biggest Medicaid MCO plans across the country are Centene, United Health Group, CVS Health, Molina is another big one, and then Anthem. But now Anthem is no longer called Anthem, and I need to look into this a little bit more, but it's called Elevana, Elevana, or Elevana. So that's basically Anthem. So you have the 5 largest MCO plans for Medicaid across the country is Centene, Anthem, which is now Elevana, UH Group or United Health Group, Molina, and CVS Health. Most likely one of those sound familiar to you in your state. Now, because they're managed care organizations, meaning that somebody's overseeing the costs and making sure they're trying to keep costs down, they want to make sure beneficiaries are receiving the utmost care, high quality care, you do have to be credentialed and contracted with the MCOs through the insurance plans in order to be able to bill and to get paid by them. They basically want to do a vetting of all of the practitioners who are going to be seeing their beneficiaries to ensure that they are qualified and that they don't have any criminal background history, any malpractice history that could put them at high risk and put their beneficiaries at high risk as well. So if you're not familiar with credentialing and contracting, the purpose behind it, please check out my playlist on credentialing and contracting. I have 2 playlists actually about it. And I also offer a course through the Thinkific platform teaching you how to do credentialing and contracting yourself with these insurance plans, their MCOs, etc. Something to note with the MCOs and when you become contracted and credentialed, you don't necessarily get to be participating on all of the managed care plans that a specific insurance plan offers, or insurance company, I should say. So if Anthem or United Healthcare offers multiple different lines of service like HMOs, PPOs, EPOs, different MCO plans, you might not necessarily be actually invited or approved to participate in all of them. That's why it's very important that you're very specific on the ones that you want to participate if you know, and also reading your contract very, very closely to see which ones are included and if there's any carve outs before you sign it so that you're aware, you can ask questions, you can ask for exceptions, etc. But again, managed care organizations, it's something you deal with all the time. You probably just aren't aware that's what it's called. And they're basically the health plans that the insurances offer to beneficiaries, to patients that you actually deal with on a regular basis to contract, credential, bill, and get paid from. If you have any questions or comments about this, please leave that in the comments below. Smash the thumbs up button if today's video was helpful. Subscribe to my channel if you haven't already, and please share this with all your colleagues whom you feel would benefit. I appreciate the support, and we'll see you next time. Bye-bye.